one of the reasons I wanted to get you on here is because, you know, you've got experience in the complaint side of dentistry, and it's something that you're speaking about soon in the ADI as well. Can you tell me a little bit about yourself, or can you tell the listeners a little bit about yourself and what you do?
Yeah, sure. So I work as a GDP, and I've been at a practice called the Briars in Newbury for quite a long time now, so 12, 13 years. Along the way, I started to do quite a bit of expert witness work. So I did quite a lot of clinical negligence reports, and then I did an LLM in medical law, at which point Neil Taylor was looking to expand Taylor Defence Services down into England and Wales, and he had approached me to see if I'd be happy to come on board and be an advisor for him. So for just over 3 years now, I've sort of worked in two roles, part of the week doing clinical dentistry, part of the week working as a dental advisor for Neil.
Okay.
Mainly
how do you find that?
complaints.
Do you enjoy that? I mean, it's a lot of work, and I'm guessing
It is a lot of work, and I do enjoy it. It can be a little bit difficult at times, actually, because you're dealing with complaints which on the face of it can be quite a negative thing to be dealing with, but our job really is to help the clients obviously manage those complaints, and fortunately most things can and are resolved at a local level. So having done a lot of expert witness work with clinical negligence cases, now the majority of the work that I do is dealing with complaints and getting things resolved at a local level, and hopefully stopping them from escalating up to litigation or fitness to practice or ombudsman complaints.
Great. And what are the more common complaints you're finding when people are speaking to you?
So on balance, mostly I'd say we deal with complaints coming from NHS dentistry. I think that's probably because there's maybe a little bit more of it going on. Often it tends to be patients who are in pain, who might have had, you know, deep fillings that have been done, that might have needed root filling, and the patient sort of alleges that they weren't informed that this was going to be the case. So I'd say that's the majority of complaints that we see, you know, pain related.
And so what kind of things can dentists do to reduce their complaints that they're generating or getting over their careers?
Oh, so I get asked this a lot, because people do want to know how can we avoid complaints, and I think the honest answer is that we're in a world where patients are really encouraged to give feedback, that can be good or bad. And if you look at the definition of what is a complaint, it's actually just an expression of dissatisfaction, which means that the threshold for something being a complaint is actually quite low. Okay. So I think dentists need to turn this on its head a little bit, and instead of thinking how can we avoid or not get any complaints, just think how are we going to deal with complaints in a very positive way when they come in, almost to the point where we don't see it as a complaint, we just see it as some sort of feedback, and we're going to deal on it and use it to improve our services. Okay.
And so do you recommend that most people have a system for complaints?
Yeah, absolutely. So I think every practice needs to have a really robust complaints procedure, and I think they need to really run that procedure as a team, with one person who will act as the complaints manager, often the practice manager. I think there needs to be somebody who's overall responsible for the complaint. So in NHS practices, that's usually the contract holder is the responsible person. And I think in a private practice, you know, one of the principals really needs to be in charge of the overall, or responsible for the overall system. But having a good complaints policy and sticking to it is going to be the way to deal with a lot of complaints in-house with the minimum amount of fuss.
Okay, and one of the things I've been hearing, and again, I don't know how true it is, but is that the GDC are getting much more efficient at dealing with complaints from the early stages, not letting it kind of drag on as long in where they're going to be kicked out, and even the ones where they do need to go a little bit further down the line, they're a little bit more efficient at dealing with that. Is that something you found as well?
Yes, on balance, I'd say so. What I've been noticing with the GDC cases that I've been dealing with lately is that they are certainly much quicker at going from the point of initially notifying the registrant that there's going to be an investigation into the complaint to actually usually closing them down, which is very positive. That system seems to be running in about 3 months or so for the cases that I'm looking at, which is a lot better than it was a couple of years ago, where it was taking sort of 12, 18 months to go through that initial sort of assessment process, which was just far too long, really, and obviously having a bit of a negative impact on the mental health of those registrants who were going through that. Yeah, it does seem to be quicker. They do seem to be dealing with single patient issues and simple sort of clinical complaints a bit more positively, and not escalating those ones maybe as they were. But equally, I think the dentists are getting a bit better at having their own house in order in terms of the record keeping. Does seem to be getting a bit better, and having all the paperwork and things that we're expected to have. So yeah, I think, you know, fingers crossed, we are seeing some positive improvements there.
Yeah, and so one of the things with record keeping, you know, you were saying is don't necessarily assume that because you've given a patient a letter saying everything that they've interpreted everything. So a letter is a part of the whole consent process, not the whole process. Is that right? Or what do you recommend?
Yeah, definitely. I mean, I think these days we have to get into the process of giving patients a lot more information so that they can make an informed choice. And it does make sense to have a lot of that information maybe in written form, as well as backing it up with a discussion. What I think we need to be a bit mindful of is that in the UK, 1 in 7 adults has the literacy skills that's expected of an 11-year-old child. And in Scotland, that is as many as 1 in 5. So a lot of our patients don't necessarily have literacy skills to be able to just sit and read long letters and understand what they mean. And I think sometimes some of the older patients don't even read them anyway. They just tend to come in wafting a signed form around. Yeah. So I think we just need to make sure that we take the time to discuss with the patient, you know, have you read this information? Do you understand it? Have you got any questions? Yeah. And possibly even practices that are able to do so could delegate a lot of this to their DCPs, who are often much better at talking to patients on their level. Mm-hmm. It's all to do with, you know, being able to understand the information to be able to make an informed choice.
Okay. And with this whole kind of area of complaint, it's an area that causes quite a lot of stress for dentists in general. And, you know, even I guess for 3 months, to me, if you're sitting there with an unknown on your shoulders for 3 months, that's a long time to be carrying, isn't it?
Absolutely. Yeah. Yeah. I often say to the clients, look, you know, half your worries never happen, but you will be a long time if you're going to spend every waking hour mulling this over and letting it, you know, dictate your life. It's too much. So really, we need to be able to develop skills to go, okay, well, this is a process that we're going to have to see through, and there's nothing we can do about it to speed it up. And we really just have to try and be able to sort of put these things to the back of our mind, because there might have been, you know, one patient that's complaining. You know, some of the times these complaints aren't justified. We can obviously always look to improve things as to what we could do better. So if there might be things that, you know, you'll think that you could address, then obviously do so. But I think dentists we can waste a lot of our life worrying about things, and that's not really good for anybody's mental health, really.
Okay. And as a general thing, I mean, that leads to defensive dentistry, especially I've found it kind of younger colleagues as well, who are kind of scared to do something without a very, very lengthy consent process, or just not willing to do it and referring it on.
Yeah. I think obviously defensive dentistry is not very good for anybody. Not good for patients and not good for dentists, and it will prevent dentists from developing their skills as things go along. Mm-hmm. Yeah, there is a fine balance, I think, that needs to be struck with not taking on things that are really outside of your skill level, but equally you have to just test that comfort zone a little bit to be able to push through it. Having said that, there's some things that we see quite a lot of, like, you know, root fillings on multi-rooted teeth cause quite a bit of problems, actually, particularly with younger dentists. I think you've just got to practice. And actually, I tend to take teeth that we take out the practice, we ask the patients, can we keep them? So I've got a great stack of teeth at the practice. If anybody's ever wanting any to practice on, that would be the way to do it, I think, is, you know, extracted teeth, ask your technician to cast them up, and then just use those to work out, you know, accessing canals, etc.
Okay. And one of the other things I wanted to talk to you about, I guess, is this kind of area of giving money back. You know, I think, is it the right thing to do? Is it the wrong thing to do? What's your view on kind of giving money back?
I think my view is always, it depends on the situation of the actual complaint.
Yeah.
So I generally tend to treat each complaint on its own merits. Sometimes I don't think it's easy to say, well, giving the money back always solves the complaint, and I certainly don't think necessarily that should be done without taking advice or speaking to your indemnifier. In many cases, actually, giving a refund can nip a complaint in the bud, even if the dentist might think that it's not the right thing to do. Sometimes it can just save a lot of aggro and stress, particularly if you've got a patient who's quite vexatious or is clearly being quite cantankerous and threatening all sorts. Sometimes it can just nip it in the bud, and it ends there and saves a lot of stress. Sometimes it's not the right thing to do because the patient might not be really looking for a refund, and you sometimes see this crops up where the patient will say, well, thank you for offering me a refund, but that wasn't really what I was after. What I was after was your assurance that this problem will be sorted out, and actually they're quite happy with the dentist. Personally, they don't want to find a new dentist, they don't want the money back and have to go and start again with somebody else, but they would just like the problem fixed. So sometimes we've just got to look really at what is the individual patient's expectation.
Okay, yeah, interesting. And is there, I mean, to put you on the spot here, is there one piece of advice that you wish that you could kind of give to the dental community to kind of just reduce everybody's complaints? Is there anything that you think people should do differently or no?
I think on the whole, the fact that complaints, the number of complaints that the GDC and the Dental Complaints Service are dealing with show that on the whole, actually, I think we're handling complaints pretty well at local level. I get asked a lot, how can I avoid this happening again? And I think, to be honest, the honest answer is you're not going to stop patients complaining, because we do live in this world where feedback is encouraged and people think that they obviously have a right to complain, and it's often to improve services rather than just to be vindictive. The best bit of advice I could give is to just accept that, complaints are going to happen, but don't catastrophize over them, because dentists do sometimes get very distressed when they get a complaint coming in. And actually, in some cases, there'd be nothing that they could have done any differently, because it just was them who was dealing with that situation and that particular patient and that particular personality on that day. Sometimes it can just be bad luck. So if you're trying to create a world where you don't have any complaints, it's like trying to create a world where there's no risk at all, and it's just unrealistic.
One of the things I wanted to touch on as well, so when we talk about the GDC, I think there's a kind of, people are a little bit confused. Some people think, well, the GDC, we pay the money, so they should be representing us, and then there's, I think the GDC kind of seem to think, no, we're here to represent patients, and I don't know what you think of that relationship, and is that different, the relationship we have with the GDC? Do you think that's different to how the GMC has a relationship with medics?
Well, I think we've got to accept that the GDC are not there for us, really. They are there to protect the public, and it is the same with the GMC. And one of the things that I flagged up years ago when I wrote my LLM project, interestingly, to the GDC, was actually there was a difference, I felt, with how the GMC were behaving towards their registrants to how the GDC were behaving towards their own registrants. And a specific example that I gave was on the Facebook. They both had Facebook pages at the time, and the GDC were using their Facebook page to say, oh, a dentist's been struck off in wherever for whatever reasons, please visit the website to find out more. Whereas the GMC's page was much more positive, and they were doing things like welcoming their new registrants onto the GMC register. Or they were some new guidance here from the Royal College of Obstetrics and Gynecologists, and we think this is relevant to all our registrants. And I think what we have seen recently is the GDC, and I don't know whether it's necessarily just down to me having a whinge in my LLM about it, although I think they did read that, and I'd certainly emailed them and said, look, I think you could be interacting with the profession more positively. I do think that they are making good strides to do that, and I think those recent emails that we've had from Stefan at the GDC have been very positive. They've been a very reassuring tone. They are linking the website now to different bits of guidance, which is of use. So I do think this is all very positive and going in a good direction.
Great. Well, thank you very much for your time there.